I'm Joe Halco, your host, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being for the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance with emotional and behavioral challenges, their mental health, substance use, or an intellectual or developmental disability. 2025 marks a milestone for NCSS Here for You, as it's the 20th year that we've produced shows that air monthly, highlighting the numerous services provided by NCSS and organizations that we partner with in the community. This month, we'll be discussing how the NCSS Access Center is responding to the specific needs of our community. Access to mental health therapy with reduced wait times and a short-term therapy model are helping individuals struggling with a variety of mental health challenges. This service model results in NCSS being able to help prevent hospitalizations as well. To discuss these programming advancements in treating individuals with mental health challenges, I'm pleased to introduce this month's guests, Meaghan Malboeuf, Program Manager of Outpatient Access and Integrated Health, and Celine Blondel, Rapid Access Clinician. I'd like to welcome both of you to the program this month.
Thank you. Thank you.
So, to get started, let's begin with the origin of the NCSS Access Center. Was this in response to concerns from the community?
Yes. So the Access Center opened about a year ago in December, and that was a soft opening where we weren't fully staffed yet, but we had responded to the community needs assessment. So a really extensive questionnaire that goes out throughout community, far beyond NCSS and clients, but to the whole community. And what we learned was that there was a much larger need for outpatient therapy services and for both children and adults, and that that be delivered with lower wait times. So instead of trying to solve a lot of different problems, we really focused in on that problem because we saw the same response in our client surveys that, they were wanting more outpatient therapy, reduced wait times, and more increased in-person therapy following COVID versus telehealth. So while we do continue to offer telehealth services based on client need, most of our services at the Access Center are in person and intended to be very responsive. So we have the same day appointment first thing in the morning. That is a same day walk-in unscheduled appointment. And then we have short-term therapy rapid access appointments that can be scheduled with a much reduced wait time.
Meaghan, you bring up one thing that I think is important, which is, one of the things that came out of COVID was more of a push for telehealth and realizing that some individuals actually prefer that to the in-person. Well, again, different things, different ways to reach people who are trying to, deal with some mental health condition they're struggling with.
Yeah. And again, we do offer telehealth because there are real reasons that people need that. So what I find when I do ask clients is that it is usually not necessarily preference, but necessity. So if someone maybe has a long drive from, say, Montgomery to St. Albans, or some from Grand Isle to St. Albans, that's a great opportunity for telehealth, especially maybe in the winter. Or we also, if someone their initial struggle maybe is extreme social anxiety, that might be a great starting place where telehealth can help. But we do find for the most part that people really do appreciate our in-person services, and it can be somewhat therapeutic in itself to come into the office and meet with someone in person.
Yeah. It's sort of like a meeting. There's nothing like an in-person meeting versus like when we were on Zoom all the time during the pandemic. It was fine. You can get by, but it's not the same, as far as interactions, off the agenda discussions, all that type of thing. So let's talk about the importance of access when someone is struggling with mental health challenges.
Yeah, I mean, I think what we hear all the time, just anecdotally from people, is that when they're ready, that's when they want to be seen. But we also know this from a mental health perspective. If you think of people's stages of change, when they're in contemplation or thinking about maybe getting some help, whether they need help, and then at some point they move to action to pick up that phone and ask for help. And that's really the time that it's wonderful to meet them in that action moment that they're feeling and to be able to connect and offer the help in a reasonable amount of time. So it can prevent a worsening of symptoms to give people the access quickly. It can quickly improve their quality of life. And, we're really trying to offer the best possible care. And so the timeliness is part of that.
If I can segue from that, sometimes just walking into the building can be off-putting. So one of the first things I like to say is, thank you for coming in today. Why did you pick up the phone and decide to call today? How can I help you today? And sometimes just by kind of settling that initial anxiety, they're kind of in, instead of, they're really afraid to walk through the door.
Sure.
And I did have someone not that long ago sat in the parking lot for 45 minutes before coming in. So...
Well, and there's the other thing that's always circling around mental health, and that's stigma. And people thinking they're the only ones who are struggling with a particular situation or condition, which certainly you all know couldn't be further from the truth. When you think of how many people, it'd be like somebody who's a diabetic or, somebody who's dealing with some other physical condition. I mean, they're not the only ones. They're one of many, and it's no different with brain-based situations. But that's a great point, Celine, is that that struggle to make the initial contact and to have that access available, maybe access, well, in this case, access that didn't exist before for this program, which can certainly help people that in the past might not have ever sought treatment.
Right. Yeah. And I think you've hit on a good point with the stigma, because there is a lot more talk about mental health these days. It's more in the media. It's more on social media. However, that stigma is still quite real for people when it's about themselves and feeling, like you said, being able to recognize and then ask for help. It can be very difficult for people. And so we want to acknowledge that. And that is part of the goal of the Access Center, like Celine described, is to meet people where they're at immediately, to put those fears and worries and anxieties aside as quickly as we possibly can.
So wait lists have traditionally been a barrier for many people receiving treatment. Could you talk about how the reduced wait times has had a positive effect on care since the center opened?
Yes, NCSS in the past has gone through periods where we honestly have had long wait times. And so what has happened with the addition of the Access Centers for outpatient therapy right now, we have very low wait times for outpatient therapy, particularly for adults. But even for children, they're able to get in much more quickly than in the past, which is wonderful. And we're really trying to spread the word on that, because I think we have gone through times, whether it's low staffing or other concerns, where we did have longer wait times that didn't feel good to the community. And right now, with the Access Center, with those additional appointments, with the addition of short-term therapy, we have really reduced our wait times for outpatient therapy, and it feels good to be able to say that to the community.
Yeah, that's a terrific advancement for the organization and, of course, for the recipients in the community itself. Now, benefits of short-term therapy. Because some people may not realize that there's all these different models that are available through NCSS therapeutically, but short-term therapy and what that means.
I look at short-term therapy as a problem-focused, solution-focused modality. You come in, I just got served divorce papers, and emotions take over and you don't know what to do. And you kind of focus on that. What does that mean for you? What are you feeling? And you kind of work on coping skills for that and possible goals to kind of work through. If someone comes in and has long-term abuse from their childhood, that's not 12 sessions or less. So it's a solution focused. You identify the problem, what's going on in your life, what just happened, what's bringing you here, and then you kind of work on that and sort out. You're the part of the team playing detective to figure out what's going to work for you. What options do you have? I really like short-term therapy. You get right to the crux of the problem and help figure it out, and then go fly, go test your wings and see if that's working for you.
And that can be very empowering for clients.
Yes.
Because you are helping them problem solve, but you're really bringing them in the process. You're finding out from their perspective, what is the issue that's really upsetting to you right now?
Right.
And empowering them with, like you said, with those coping skills.
And sometimes you don't know what you're feeling. And I like to use divorce because you see that a lot, and there's a shock, there's an anger,
Sure.
And then there's oh my gosh, what's my life going to look like? And so we scale it back down to, okay, here's where we are right now. And we don't know where you're going to be, but over 12 sessions, and that can be once a week, every 2 weeks, or once a month, depending on how well you do in those sessions. And then you're just learning skills and kind of thinking through your options and putting that into motion. And I feel like I'm a coach. I just kind of follow up to see how people are doing with what they decided they were going to do. Does it work? Great. Does it not work? Let's reevaluate.
And you mentioned divorce. I would say short-term therapy for almost any life transition
Correct.
phase. So any divorce, loss, relationship changes,
Job changes.
Yeah.
Yeah. Because these things come as a shock and we don't know what to feel. So immediately validate, wow, you got fired. That must suck for you. Yeah, it does. But it's not the end of the world. And then you start kind of branching out from there. I think that's how my mind works. And you just start branching out and you see what options people have. Okay, you wouldn't take that option, but it is an option. And sometimes I like to draw it out in bubbles and see which way do you want to go and which bubbles connect.
Helping people shift perspective.
Correct. Validating their emotions and helping them shift perspective to move forward.
One of the other things that I find encouraging in what you were saying is that the duration of time between visits is really predicated on what somebody feels they need. So
Correct.
As you said, some people can be done in a couple of months. Others, it would be a year.
Correct.
It really depends on their circumstances and what's going to work best for them as an individual.
Yeah.
Yeah, we've shifted our language from talking about short-term therapy in number of weeks, and actually this was Celine's idea, into number of sessions instead. So because someone might not be available for
Sure, yeah.
but it still may be the correct course for them.
And, we're constantly evaluating as we go. And if it looks like, we've worked through an issue, but then, I remember this from a child and it looks like it's going to become more involved, then we refer to outpatient where they can have ongoing therapy.
Sure. And the reverse of that, if I heard you right, is that the short-term therapy does not need to be 12 sessions.
No.
Maybe 2 or 3 is all someone needs. And like you say, they're off and running. But what they needed was just that couple of visits to sort
the
things out.
validation. Sometimes it's just collecting the ideas. I have had a few folks that have come in one session. I think I got what I needed, and that's great.
Yeah,
That's
absolutely. Absolutely. And there's a great point that if one session is all it took for somebody to kind of figure things out, if they never made the call, never walked through the door, and then that festered over weeks, months, years, now you have a different situation,
Correct.
circumstance that they're struggling with. So,
Well, and the other thing I like to say about short-term therapy is that someone can come in and, like you said, it could be 1 session, it could be 12 sessions. As long as they've had a positive experience, as long as they've felt empowered or helped get that shift in perspective, the door is now open to them for a long time, So we tell people you can come back. It's not as if but if they've had a positive experience and they have felt heard and validated, they are more likely to come back. Maybe when they have another life transition 5 years from now.
Yeah, absolutely.
And folks do come back.
Yeah.
They do come back. Life happens, and you never know what that's going to look like.
Absolutely. So another thing that is offered is same-day outpatient therapy. So how does that part of the program work?
So we wanted to have an option for people to really just come in immediately, who we have never had that before. So that is really our newest addition, and that's only offered at the Access Center at 12 Houghton Street. But most people I find actually want a scheduled appointment, but this is a really nice option where if something does just come up and maybe your doctor suggested the day before that you see someone, so you give this a try the next day. And so people can come in at 8:30 in the morning and they fill out the paperwork and they would start that assessment that Celine just referenced right at 9 o'clock with the therapist. And, of course, there's always the risk that two people could show up and we only are able to serve the first person, but honestly, that rarely happens. We usually are able to accommodate people when they come in for that same day appointment. So we have had, that's been a slow start because it's such a new service. I think that people still maybe don't realize that is available daily. But we do want to have that opportunity for people who, for whatever reason, like today is the day for them.
Yeah. Yeah.
And in that initial assessment, you can, at the end of it, you can decide, do you want to come back? Do you feel like another session? And it's totally up to the client if they want to come back, or no, I think I got what I needed. Yeah.
Well, the great thing about it is, and to your point, Meaghan, is that, I mean, there probably are times more than one person shows up, but for that one person who does arrive, and you get them started thinking about, once again, outcomes and everything that goes along with it, is there's been no delay in trying to seek a path that's going to work for them. So
yes, and because of the way that we've set up the Access Center and the addition of short-term therapy, so even if two people came on one morning and only one was able to be seen that 9 o'clock slot, really with the reduced wait times and the setup that we have now, we would be able to schedule that second person for an appointment very likely within a week or less. So, I mean, we do want to encourage people to, like I said, when you're ready, come ask for help and we will do our best to accommodate.
yeah. Now, as we're producing this show, the holiday season certainly contributes stressors this time of year to many. And could you speak to how this model can actually address these factors for individuals that are struggling this time?
So yes, we're sliding into Thanksgiving and Christmas, and I hear people say, I got elected to host this year, and that is stressful if you've never hosted, having the whole family over. And so what does that mean? Does that mean you have to do it all? Let's look at that. What does hosting mean to you? You have to have your house clean. You have to prepare everything. And no, it doesn't. You can ask for help. We have so many options here. You can buy the food. You can fix the food. So that's where we kind of problem solve to kind of take the stress away from it all. It doesn't have to be stressful. You can decline to host if it's really that angst provoking for you.
Sure.
Yeah, and I think it is important to remind people the holidays, on TV or the media seems like a wonderful, happy time, and that is not a reality for everyone. A lot of what is stressful about the holidays are the expectations. As you mentioned, that's a huge stress on a lot of people. But it also can be a time that exacerbates grief and loneliness for people. And I think that's really important to remember. And, it's a time where there are a lot of expectations, not just social, but financial. And that can be extremely stressful for people. And so I think, part of just having this discussion is just opening that to other people to say, it's okay if this isn't your favorite time of year, and it's okay if this is stressful for you, and to definitely reach out and tell people. So, one of the things I say is you can start with your own support group, maybe tell your family and friends that this isn't how you feel for the holidays. But also recognizing, maybe you do need maybe it is a really difficult time of year. Maybe you need a little bit of extra support from a professional. Like, is it really impacting your functioning? Are you shutting down from the stress of this?
I think the holidays also bring, if you've had loss within that first year, that can be really tricky to get through the holidays. Every day is a struggle with loss, but holidays are more so. And so we can look at that. What does that mean for you? And how can we start moving forward? How can we change that perspective for, how do you honor the person? And so there are people that sit home alone during holidays, and there's so many community events. Are you familiar with these? Transportation can be an issue. So it's just kind of looking at what is the problem and problem solving. It really makes you think, like all the resources that are available. Oh, I couldn't do that. No, you might not do that, but it is an option. But here's some other, I could do that. And just helping someone kind of navigate that path.
Yeah. Go ahead.
Just allowing people to know that it's okay. We talk about stigma, but I think sometimes it doesn't feel like you're allowed to say, this is a stressful time for me, or I am feeling this loss so much that I don't want to participate in such and such event. So that is part of the stigma, right? Is that getting rid of the stigma is to be able to say, this isn't right for me. These expectations aren't fitting what I'm able to do right now.
Absolutely. Yeah, and loss comes in many, many ways. It's loss of people, family, friends, loss of a job, especially unexpected loss of a marriage, all of those various things that can complicate this time of year. So,
yeah.
Okay, so the Access Center program is not designed to assist someone that's in immediate crisis. If someone is in immediate crisis, who do they call?
If somebody comes in and they are in crisis, we can reach out to the crisis services, and they can come to our building. There is an office there where they can talk to the person and figure out what's going on, whether they need hospitalization, whether they want to continue and come back and maybe have an intake for therapy. Crisis will come and work on that. And there's also 988. If somebody wants to call 988, that's 24/7. It's more of a warm line, and people can talk about, again, loss or holidays. You can call 988 anytime, anywhere, and an operator will answer.
Yeah, and so I think we just wanted to delineate with, because Access Center is a very welcoming name. So everything that Celine said is absolutely accurate. And when we talk about crisis, what we really mean is that emergency services call where someone may be feeling either suicidal or homicidal, wanting to hurt someone else, like those extreme feelings that would need a very immediate response. That is what we mean when we say that's a call to emergency services or crisis, which is the 524-6554 at NCSS or 988, which I do think it's important, like Celine said, to mention that that can be used as that's a warm line that can be called for any reason.
24/7, somebody will answer.
Yeah. And I think one of the proud moments for this organization is the fact that this organization was the first one in the state of Vermont to assist with that initiative and have professionals on the line and remain so today.
I have been part of it since they started.
As we speak, yeah. And I think, Celine, the important thing about that, and both of you are so right, is whether somebody is feeling suicidal or they want to hurt someone, or they're just don't know who to talk to, having a bad day and don't know which way to turn, that line is for all of those.
Correct. And there's a text line too.
Yes.
The bulk of the calls that I have taken over the years have been people, they just don't know what to do. And they just need validation and let's figure out the direction. And there are several I know by name. They call quite a bit, and they just need, they don't have anyone in their life. So it's kind of like a check-in. It's a great, I like 988.
It's tremendous. And, having the three numerals there, a 988 versus a long, what have you, to try to figure 1-8 out of this, that. Just like a 911 scenario, people over time will really get to embed that in their minds to call if they're struggling. But I think
that is the hope, right? That, again, like breaking down the stigma, we're trying to break down making it difficult to know who and where to call. And so 988 being one, a warm line, meaning it's your definition of what the crisis is at the moment. And then also just being easy to remember, easy to access. You mentioned the texting. We find that young people are more likely to be comfortable at a starting point anyway with the texting. So just trying to find a lot of ways to connect with people and be available to people.
And if I can just, at a conference once, I was listening to someone from the national organization that started this initiative. And they told the story of another state, but they told the story about, and this is to the text point and the importance of it, is that a young person was texting. They were really struggling. They were feeling suicidal. Anyway, as the text was going, they said something about, well, your parents, or do you have support, or whatever. And what they learned was that the parent was in the next room, this was 10 o'clock at night, in the next room. But the household rule was after 10 o'clock, no communication between the parent and their children.
Wow. Yeah.
So think of that. They were on the other side of a wall. They were struggling immensely. If they didn't have the ability to do the chat, they had said they wouldn't make a call because they were just too mortified to do that. But chat was the savior in their particular case, that method was available initially. So I think that speaks to what you're saying, the 24/7 and everything else.
There are a lot of stories like that. I just find 988, the availability of it. If for some reason, if we have 2 or 3 operators on and it's busy, it'll roll into another service and it's always answered. It's always answered. And there is no wrong call. Like, I didn't mean to call. That's okay. That's okay.
Yeah. Yeah.
Yeah, it's a great service. Whoever came up with that, it's amazing.
It is. And once again, it breaks down that stigma barrier that we talked about earlier. And in any way that can be done when talking about mental health disorders is a win.
Well, in all of these services, whether it's the Access Center, a same-day appointment, a little bit of short-term therapy, a call to 988, we're always trying to prevent a worsening of symptoms, right? We're trying to help people in the moment, trying to improve their quality of life, trying to help them feel a little bit better, and in the hopes that it doesn't escalate for that person.
I think it boils down to a lack of someone to talk to. I was thinking about this the other day. Like, a lot of us have a best friend, and sometimes we talk to our best friend, but some people don't have that, or they don't want to talk to their best friend about maybe the fact that their marriage is ending. And these are life circumstances, and it's kind of, I don't want to say we're your best friend, but we're that neutral third party that can hear what it is you're saying and see how it's affecting you and kind of help you guide. And it's just someone to kind of talk to. Everybody needs somebody to talk to.
Yeah. And, coming out of COVID, I hate to keep going back because it's not that long ago, but yet it's at least.
Is it really over?
Yeah. Well, that's the thing. In this industry, it's far from over. But isolation was exacerbated with people at every age.
Yes.
So that becomes another kind of barrier to a lot of individuals seeking treatment.
A barrier and a cause, I think. We see with anxiety and depression, which is a lot of what we see, isolation can increase, those symptoms. The counter to that really is a sense of belonging or a sense of comfort and validation or some of those other things that we've been mentioning. So it is important that people find someone to talk to.
Yeah, absolutely. And with what you are doing with the Access Center is just terrific. And with that, we will leave it there. Believe it or not, our time is up. I do want to thank my guests, Meaghan Malboeuf and Celine Blondel, for sharing their insights on the NCSS Access Center dealing with access, reduced wait times, and short-term therapy that is available all the time on Houghton Street in St. Albans, and how it benefits our community. I also want to thank you, the viewer, and listeners for spending time with us again this month. You can learn more about all of our programs and services by logging on to ncssinc.org. I'm Joe Helko, and I'll be back next month with another episode of NCSS here for you.